Hi, my name is Heidi Koschwanez, and I'm a third-year medical student at the University of Kansas School of Medicine on the Wichita campus, and I'll be presenting research on behalf of my colleagues, Dr. Jamie Harrington, a certified nurse midwife and assistant professor at Wichita State University, Mary Fisher and Emma Beck, who are also third-year medical students, and Dr. Michael Kennedy, who's the principal investigator for this research. So like many states across the country, Kansas is facing an obstetrics provider shortage in rural communities. In fact, 77 of Kansas's 105 counties do not have OBGYNs. And moreover, there's been a steady decline in the number of family physicians performing obstetrics. While family physicians strive to meet the need of obstetrics care in rural areas, certified nurse midwives are well positioned to support family medicine obstetric practices in rural counties with sufficient birth volumes. However, little is known about the extent to which certified nurse midwifery's practices are occurring in rural Kansas hospitals. The goal of this research was to determine the number and the geographic distribution of certified nurse midwives residing and practicing in rural hospitals in Kansas, as well as to investigate the anticipated trends in the certified nurse midwifery workforce in rural Kansas in the upcoming 5 years. So from June to July of last year, 2019, rising second-year medical students taking part in the summer training option for rural medicine, the STORM program through the University of Kansas School of Medicine, contacted senior hospital administrators in Kansas and requested their participation in an online survey. The surveys were distributed to 99 hospitals, one survey per hospital, spanning 83 of the 99 non-urban counties in Kansas. The survey questions were based on a review of the literature and on recommendations from 4 practicing certified nurse midwives working in Kansas. The surveys included both closed and open-ended questions for qualitative and quantitative analysis. The data on the number of certified nurse midwives working, or living rather, in Kansas was obtained from the Kansas State Board of Nursing Data Mailing List. So for our results, we had a response rate of 61%. There was no significant difference between the survey responders and non-responders in terms of critical access hospital status, labor and delivery services, annual birth volumes, county population densities, or geographic location within the state. 37 of the 60 hospitals that completed the survey had obstetric services. However, only 1 of the hospitals reported having a certified nurse midwife working. 4 of the hospitals were planning on hiring a certified nurse midwife in the next 12 months. Overall, there was a consensus amongst the senior hospital administrators that certified nurse midwives could increase women's access to healthcare in rural Kansas. However, 86 of the hospitals did not anticipate the number of certified midwives at their hospitals to increase over the next 5 years. The reasons included a preference for hiring physicians to cover obstetric services, a lack of interest by physicians and/or the hospitals, hospital practice not to employ certified nurse midwives, a lack of patient volume, and a lack of certified nurse midwives in the area. So to expand on this last point, there were actually very few certified nurse midwives living outside of the urban counties in Kansas. According to the Kansas Board of Nursing data, there were 71 licensed certified nurse midwives living in Kansas. Almost 75% of these midwives lived in our 6 urban counties, primarily in the Kansas City area. The remaining 19 midwives were living in densely settled rural or semi-urban counties, and only 1 certified nurse midwife was living in a frontier county. There were some hospitals that were looking to increase the number of certified nurse midwives over the next 5 years. And using qualitative analysis, these hospitals reported a need for more labor and delivery coverage, as well as viewed certified nurse midwifery coverage as a growing trend that they were looking or open to provide. So overall, taken together, our study found a low penetration of certified nurse midwives in the rural and frontier counties and in the workforce there. And it brings us back to our original question of where are the midwives? For future research needs to focus on understanding the factors that are limiting certified nurse midwives from expansion into the rural parts of our state, because these midwives represent a potentially untapped additional obstetric workforce for rural Kansas. The next steps for our research would be to focus on sending surveys to rural OBGYNs and full scope family medical doctors to learn more about their perspectives on increasing certified nurse midwives in the rural hospitals. So with that, I'd like to thank you very much for taking the time to listen to this presentation. Our study was supported through various foundations as well as through the University of Kansas STORM program. I'd like to also acknowledge the midwives who helped us with this research, and to Dr. Akut at the University of Kansas for his statistical consultation. If you have any questions, you're welcome to email me, and I hope that everybody has a healthy summer this year. So thank you. Oh, and I guess if you have questions now, you could ask me too. You don't have to wait to email me.
Hi, thanks so much, Heidi. This is really interesting, and it is a topic that is very interesting to me. I did supervise a certified nurse midwife here at our hospital for a period of time until she had moved away, and it was a great addition to our area here. So my first question is, what interested you about this topic? And I guess a little more about what do you see the role of certified nurse midwives in Kansas's delivery environment?
Okay. Well, actually, what got me interested in this, it was because I lived overseas in New Zealand for 8 years, and I had my first 2 children in New Zealand, where 75% of children born in New Zealand are born with midwifery attending. And so it was a really good model for that country. Most of that country is rural. And so when we moved to Wichita 3 years ago, I was pregnant with my 3rd child. And I first thought, oh, well, I'll try to find a midwife to deliver the baby. And so I contacted one of our midwives here, and they said, well, we could do it, but we aren't allowed to deliver in a hospital, which was much different than in New Zealand, because all the midwives would go to the hospitals to deliver if that's what the mom wanted. So I thought, well, my husband and I discussed it, and we were like, well, we really would like to have the baby in a hospital in case something goes wrong.
Yeah.
So we declined using the midwife, which is unfortunate, because I really think that the midwifery care is special. And I had great medical care from an OBGYN, but I do think that midwives provide a different perspective on the birth. And I think that that is really nice. For my 4th baby, I had also here, and I had a family doctor, and I did feel that the family doctor was more in line with actually the certified nurse midwife, and I really liked that experience. Now, given that most of Kansas is rural and that there is obstetric deserts all over the place, and these certified nurse midwives are very skilled and trained, it would seem like it would help reduce the burden on some of the rural counties to be working with a family doctor to help lighten the load. That's why I was interested with this research. I was really surprised from my own experience that they weren't allowed in the hospitals.
Right. No, and I love the point you make. And I think it's very interesting too, that you had that experience of delivering with a family physician as well. I think that's why CNMs and family medicine go so well together is I think in general, we do have a very similar philosophy on birthing and the birthing process and have that really special relationship with our patients. And I think that's why, CNMs coming in to help, especially in, family physician practices makes a lot of sense. There is a lot of shared philosophy and view on how childbirth goes. And I certainly loved having the one I worked with, as did my patients. And I think you hit on a really important point too in Kansas, that often people are left making the decision between a hospital birth or midwifery care. And that's not a choice I want people to have to make. I want them to be able to make that choice of having the care that they would choose in the location they would choose, and not having to make a decision between those things. Was there anything when you were analyzing the data that you found surprising or that you didn't expect?
I was surprised that though a lot of the hospitals felt that certified nurse midwives could increase access, so very few of them were interested in actually having certified nurse midwives on their staff. And I don't really fully understand that.
And speaking from our perspective of having done it, part of it is probably the, we don't know how to do it. What does that look like? What does that collaboration look like? What does it look like onboarding them? What does your contract look like? We started from zero, having an idea on how to write a contract with a certified nurse midwife. But I do feel like if more of us could get together and, possibly share the experiences and make that a little bit easier, maybe it wouldn't seem so daunting. If you're the only one that you know of that's doing it, it is very daunting to kind of start that process. So, no, I would also love to see the expansion of the use, and could see it as very helpful for rural areas and obstetric deserts. As another addition to the workforce, because CNMs can also add a lot to the gynecologic care and just women's health care as well, which can be so helpful, and was something I didn't really think of before I had worked with one. I definitely just thought of it as the delivery aspect, and didn't really know enough about it to understand the contraceptive option help that they provided, as well as full women's health care. So
yeah, it's really what I was learning more about it through this research, and it is quite encompassing what they can help with.
Yes, absolutely. When I think of it in my practice of, that ability to have some of the, the well women's and the gynecological acute issues that come in, that you sometimes feel stretched in a busy day to get to, having another provider that could offer that specialty, because a lot of times in our practice or in our area, they'll come to me, especially between my husband and I, as the provider that does a lot of women's health care. It would be great to have another provider that did a lot of women's health care.
Yeah, that's really nice that you've had experience with this.
Yeah, and again, when it was, when she had been a nurse in our facility that had then gone on to CNM, but when we went to look around the state to say, okay, what does a contract look like? What does this collaborative agreement look like? Who has done this before in a rural area? There wasn't anybody. So yeah, I think that if we could make it a more accessible and easier thing to do, there might be the interest in other facilities to bring that on board.
Yeah.
And I think, like me, before I was familiar with her, I didn't know what scope and breadth they could bring. I didn't understand they could help me with more than just the prenatal visits and the deliveries and the practice. So some of it was educating about what they can bring and what their scope is. So, well, thank you so much, Heidi, for this. That was so interesting. And when the next part of the project comes on, I will certainly get my survey in.
Okay. Well, thank you very much for your time.